I mentioned at the start of the show, we have a guest joining us. We have a doctor joining us. We'll see her on the screen in a moment, Dr. Ingrid Skop. And she is in San Antonio. She's been in the practice of medicine. She's an obstetrician for 25 years. And she's also part of the, I believe it is the Doctors for Trump, or we'll let her tell us about that. But the reason I have her on, I want to tell you just a quick thing why I invited her on. So last night, I have a good friend in Dallas who's a doctor, a woman doctor. So last night she called me and she said, do you realize, did you hear about that President Trump held a meeting on healthcare policy with America's doctors on September 24th in North Carolina? And it was a big gathering of doctors who came to listen to President Trump's healthcare plan. And I said, no, never heard about it. And I, as you know, if you listen to my show very often, I'm pretty darn wonky. I read about everything. I never saw a reference to this. And the reason my friend was calling was, she said she was going over her notes. She attended that meeting in North Carolina. She's going through her own notes. And she said she was so frustrated that the media, A, didn't report in this meeting, but B, they continue the messaging the left is trying to send out that President Trump doesn't have a health care plan, doesn't have a health care policy. And you heard even in the debate when I believe Biden said it in his, as well as I believe Kamala Harris said in the VP debate. Essentially, Trump doesn't have a plan. He doesn't have any health care plan. And what my friend, the doctor, was saying last night when she called me is, when leftists say that, what they mean is he doesn't have a centralized power in Washington, government control over the whole healthcare system plan. He doesn't have a plan to compete with the Democrats, which, regardless of what Biden says, they're all headed towards socialized medicine. They're going to head towards single payer. And this is what my friend was saying is they don't count having responsible policies put in place by the president as a plan. It only counts for a plan if it is centralized control of the healthcare system. So she, this friend, wanted to share with me that that conference occurred in North Carolina and that there is actually plenty of thinking happening on the Republican side under President Trump with respect to healthcare policy in America. So now I'd like to introduce and welcome to our show, Dr. Ingrid Skop. Hello.
Thank you, Debbie. I appreciate the opportunity to come and discuss an issue that I'm passionate about. I agree. Most Americans, because they're not given the true story by the media, don't understand. They don't understand Trump's plan and they don't understand Biden's plan.
Well, I bet you sound like you do. So you know what? Actually, you told me, we talked on the phone today earlier, just briefly, and you mentioned on the phone that you had actually been part of phone calls during the Trump presidency, his making calls out to doctors. And I didn't even know such calls happened. So I love if you could just start telling us about that.
Yeah, there are a number of groups that are having conferencing calls almost on a weekly basis with the White House to discuss helping to get this information out to the public. I think most people understand that there are major problems with our healthcare system the way that it's currently being run. We know that it's terribly expensive, that about 1/6 of our gross domestic product goes toward healthcare. And yet we see that there are people who cannot get the coverage that they'd like. They cannot get access to the medications and to their physician, to the physician that they'd like to see as often as they should. We're told that Biden's plan is going to build upon the Affordable Care Act, but in reality, that's not true. He's incrementally inching toward socialized medicine. And I think when we look at the people such as his vice presidential candidate, who have said without a doubt that they want socialized medicine and they would like to see private insurance go away, that's not what the average American wants. We have to make a distinction between having insurance coverage and having medical care. If with single payer healthcare, everybody would have coverage, but there's no guarantee that they would get the care that they needed. There would be long lines, as there are in Canada and the UK, to access services. Many times there are not primary care physicians available. Trump's plan wants to, in a small way, correct many of the problems with our current healthcare system. He is doing this through executive action and also through legislative action when he can. Things like improving access to generic medications, allowing health service accounts, health savings accounts, which use pre-tax money to be used for more medical services and medications. There is something called a pharmacy gag clause that does not allow a pharmacist to tell you when an expensive medication has been prescribed that another less expensive medication that can treat your illness just as well is available. They're forbidden to tell customers that. And honestly, many times.
I'm sorry.
Oh, sure.
Where is that? I've never heard of pharmacy gag clause. That's in federal law?
It exists. I don't know what the legislation is, but it is, as a physician, I can tell you that doctors don't know what things cost. Many times a drug that's been available for 20 years, we may assume it's inexpensive. And then a patient will call and say, this was prohibitively expensive for me. Many times it has to do with what the coverage is through the insurance company. And in fact, there is some amount of give and take between insurance companies, pharmacies, and pharmaceutical companies, where they amongst themselves decide which drugs they're going to make the most profit off of, and those are the ones that they will preferentially give to the patient. So there's a lot of I would say bureaucracy and middlemen in our healthcare system that a direct to consumer medical approach, a direct relationship between a physician and a patient that cuts out a lot of the middleman. We could easily cut the cost of many of these things without sacrificing care at all. And in fact, probably improving the quality of the care.
That's a ton of information. I was trying to take notes while you're talking. I gave up. So, but I love that. I love that you're so well informed about all this. And I do think I'm going to go back to my one little point at the beginning. I know that you're in the practice of medicine. You're not political, but I am a little bit on this show. I'm a lot in the show political. But I think that the assumption the left has been trying to argue, and in this election cycle especially, Vice President Biden and Senator Harris have been arguing that Trump has no plan. He's not doing anything. So, but you're talking about things now that you're describing in the Trump plan that really are, they're not centralized control from Washington medicine, but they're actually addressing the challenges that you have found in your practice of medicine, and the Trump administration is trying to address those through policy changes. Is that accurate?
That is correct. In many ways, Trump is trying to make the relationship with the patient and the relationship with the doctor to be the priority instead of the relationship to the insurance company, to the bureaucrats, to all the other middlemen. And in regards to the individual exchanges, and just as he does in so many areas of the economy, Trump wants to open insurance up to the free market. Competition will clearly drive prices down, and that will enable people to find more affordable plans when they can be bargained in a larger group, maybe across state lines. So there's many free market approaches that can really help, I think, to drive down the cost. The ACA mandated that people buy plans that had a large amount of coverage many times that they did not need. If a woman had a hysterectomy, she was still mandated to buy a plan that covered obstetric care. So President Trump is trying to initiate the ability to have plans that are more specific for a person's given needs, that will clearly also be less expensive to that person when it doesn't cover everything that they're not going to ever need to use. So there's many other ways that he can help to make things more affordable for the patients.
Oh, yeah. You know, just the whole concept of an outside of government person, President Trump, coming in to become president and trying to help with the healthcare system. He's bringing his own thinking from his life, which was not immersed in government programs, not immersed in Congress and the Senate, but rather just he understands free markets and he sees those principles. and brings them to bear in so many different aspects of governing. But I want to go back to what, it's so interesting in America. People complain about the healthcare system, and I think part of the problem has been people don't know to whom to attribute blame, or is it the fault of the insurance companies? Are they the bad guys? Is it the bureaucracy in Washington? Is it the federal law? Is it federal regulation? And all of that, it just seems it becomes in people's mind just so overwhelming that the answer can seem, and the argument of the left is, well, yeah, it's gotten out of control, costs are out of control, all these different factors weigh in, and the only answer, says the left-wing minded person, the big government kind of person, is just put it all in the hands of the government, let the government take care of all of it, we'll dictate prices, we'll dictate. So tell me what's so wrong, in your view, with that approach of having that the left has, just let the government take it over.
Well, a couple of facts to be aware of. Physician reimbursement physician salaries are only about 9% of healthcare cost. Hospital reimbursement is only about a third of healthcare cost, and medications are only about 9%. So the rest of that cost, which is approximately 50%, is for things that do not add any value or add any medical care. So that's the bureaucracy, that's the insurance companies. We all know that when the government, well, first of all, when you have no competition, costs go up. And I think we are all aware that when the government runs something, it does not run as efficiently as it would if the free market system ran it. As an example, we've all know how many problems are in the Veterans Administration healthcare system. That would be ultimately what a single payer system would look like for every American. Medicare beneficiaries, when they go from a private insurance to Medicare, in almost all of them will have to buy supplemental policies because Medicare by itself will not cover the medications that they need and will not cover all the services they need. So why should we give up a great system that needs some tweaking and can be tweaked? And President Trump knows the things to do to tweak the system, to make it more efficient, to make it more competitive, to make it more cost effective. Why should we give that up to go down a road such as in the UK and Canada, where there will be long lines and people will not get the services that they need, and people will die waiting for services as they have in those countries? The cost will go up, the care will go down, physicians will be disincentivized to continue working. It can only lead to poorer quality care for everyone. And we know how to make it better. We know there are changes that need to be made to make it better. One of the other physicians involved has an analogy that I love. He says, Obamacare and the plans, for example, that are offered by the Democrats, these big, complex, expensive governmental plans, are like a Hail Mary pass in football. Like if it works, it's great. But if it doesn't, and usually it doesn't, usually it hits the ground with a thunk, you've wasted your chance. President Trump's plan is like the short running game. The 5-yard, the 10-yard carries are what win most games, and that's what's going to get the ball down the court. And I think if we think of it that way, it makes a lot of sense. We know where problems lie. Let's address that specific problem, improve that area, and do that as much as we can. We're going to improve our healthcare system, make it more workable and more affordable for everybody, as opposed to putting together an incredibly complex thing. The ACA ultimately had 20,000 pages of regulations. All that does is creates a headache for physicians, raises the cost. It has not improved access for my patients. Initially, when the ACA came out, I saw a few patients switch over to those plans. And since that time, I've seen many of those patients drop the plans because your viewers or your listeners are probably aware, the deductibles and out-of-pocket costs for the ACA plans are incredibly high. Most people will forego care unless they have a catastrophic thing, because $5,000 to $12,000 in deductible, when on top of paying for your insurance coverage, is more than most people can stomach. And so many people have dropped the ACA plans. I should note, because it's so frequently mentioned, that Trump does not want to cover pre-existing conditions, and that's a flat out lie. Every time he's talked about healthcare, he said, this is my favorite part of the ACA, that we continue to cover people who have health problems. It should be noted that pre-existing conditions is a insurance term. It's not a doctor term. I don't think in terms of, oh, this patient has these pre-existing conditions. For me, it's their health history. And I take every patient where they are. I don't ever refuse to see anybody because they're more complicated than the next person. So doctors don't think that way, but Trump wants to cover all of those people. None of us want to see those people who most need care to be left out. One final thing to tell you, though, is that the ACA plans, none of those covered or were in network with any of the premier cancer facilities, Memorial Sloan Kettering, MD Anderson, the Mayo Clinic. If you had a pre-existing condition, got the ACA insurance, wanted the best cancer care, you can't get it. They're not in network with the premier institutions. So those people aren't getting the care they need either, despite the rhetoric.
That is so good to know. I did not realize that about the ACA. And I also think it's a little bit similar to my point in the first 5 about whether you're going to believe that what the polls say. They have the polls that, show Biden's up 10 points, and then you say, but look at the crowds and the whole crowds that are filling the stadiums every time Trump goes everywhere. Look at the crowds that are showing up at the boat parades. Those are the real tests, and the same kind of thing here is what you're saying. This whole concept that you have people who, your patients, Dr. Skop, coming to you, and you notice when the ACA, which I assume everyone knows, ACA is referring to Obamacare, the Affordable Care Act is Obamacare, ACA. When it first came into place, you saw some of your patients, Dr. Skop, go ahead and go over to ACA plans, and then you saw them come back because they soon realized that all of the promises and as somehow providing the perfect kind of health care or health insurance simply was not realistic, was not true, and that you came to realize that from your own patients. That's great to know. And on this pre-existing conditions thing, I did want to mention to our listeners, I just think, like every other pipe dream of the American left, somehow they can just paint a picture that everything will be perfect, everything will be provided, and it'll be free in this la-la land thinking of the American left. And the simple fact is, healthcare costs money. It costs money to educate doctors. It costs money to develop medicines. It costs money to run hospitals. It costs money to provide healthcare in 1,000 different ways. So someone's ultimately paying. When the government's controlling it and the government's deciding what's available, you're going to have whatever limits the government decides are acceptable. And on pre-existing conditions, government, to be really clear, President Trump did commit in an executive order, he will veto any health care bill that doesn't cover pre-existing conditions. So also, I want to go back and ask you, Dr. Skop, you were talking earlier about how President Trump had, during the course of this first term, calls with doctors around the country. What kind of things were you talking about? What kinds of issues related to healthcare were on those kind of calls?
I think he really wanted to hear from the physicians, what is the reality in your world, and what can be done to make it better? I think there are so many physicians who are disenfranchised, who are burned out. So many doctors spend a large amount of their time, probably more than 50% of their time, not face-to-face with patients, but working with the electronic medical records so they can generate a paper trail of what they're doing in order to get paid. Many times, my husband's a psychiatrist, he has some patients who require specialized medications more than just the average generic that's been around for 30 years in order to keep their mental health in control, so that they can live a life. And he spends more time on the phone trying to get the insurance companies to approve a medication. So President Trump wanted to hear about those type of things. He's very interested in direct primary care, in a doctor and a patient entering into a contract without the large amount of middlemen that we discussed earlier. He cares about the patients. I think some of the executive orders that he's done, just the right to try legislation. He's done so much to make drugs available, generic drugs, getting needed medications to the public rather than being delayed with red tape. It's clear to me, and I think it's clear to the Americans who elected President Trump 4 years ago, it's clear to me that he cares for the average person who's just trying to live the best life they can and working hard. And so he's trying to make a healthcare plan that is right for them so that they and their family can stay healthy and live the American dream rather than spending way too much of their salary on insurance, paying way too much on deductibles, avoiding care they need because of the high deductibles. I think he really cares for the Americans and wants to make the system work as well as it can for them.
I love that. And I want to go back. I like your friend's analogy about football. I think the idea in life generally, you kind of move things down the path. It's the way you learn a new trade, you learn a new area of study. You don't just sit down one night and memorize everything and you wake up the next day and you're all set. It takes progress, it takes learning, it takes adjustment, it takes correction. It's incremental changes in tax system, many other areas of legislation. You've got to work the problems out. And somehow this kind of utopian left-wing thinking that says, oh, none of that, don't bother with any of that, don't bother with fix, just put it all in the government's control and we'll just take care of everything. And it has an appeal to the more a kind of a simple-minded appeal. Sure, let's just forget all the complexity to it all. I was going to mention also. I saw some of the literature summaries made of this meeting that President Trump held with the doctors in North Carolina on September 24th, where he actually laid out his plan and stressed the idea. I'm not doing a big government takes over the healthcare system. And now that I understand from you, Dr. Skop, that you've had conversations, you and other doctors, over the first term of President Trump's presidency, giving input, telling him what's needed, working in that. And this is the way real policy is made by grown-ups, by people, serious, substantive people. You listen to input, you make adjustments. But what came out of the one thing that came out of the North Carolina meeting was trying to summarize the argument that President Trump is making for approaching fixing the healthcare system in the ways that he is considering. It's 3 points: better care, more choice, lower costs. Those three things are what he is offering through the vehicle of these many small changes, moving through, figuring out where's the hang up, where are the costs coming from, where is transparency lacking, where is unnecessary costs arising. And I saw, the more I read about it, the more impressed I was. I wish I'd seen news articles about it a little bit, explaining it more, because I think that would help people a lot. And so, do you have any other input about where you think President Trump is headed, or what would be helpful in your medical practice and making the practice of medicine better in America?
Well, I think he's done an incredible job moving the ball forward despite record opposition from Congress. He's done as much as he can do more in terms of executive orders. And I think he's realizing, and the further he and his administration get into understanding the problems, the more they're realizing just how many more things they can do. You mentioned price transparency, and I forgot to even bring that up, but nobody knows what anything costs. You go to a hospital for a gallbladder operation, you have no idea, does this hospital charge 5 times as much as one down the street? I mean, there's no transparency at all. That's another thing that he's done. He's requiring the hospitals to post their prices. Surprise medical billing is another big thing that harms patients. Out-of-network providers. As an OBGYN, a patient may come to me for surgery. My office tells them, here's what your costs are going to be. They end up with an anesthesiologist who's out of network. Somehow the hospital's out of network. Nobody knew. And just crazy, so in some cases, 5 or 10 times the expected charges come to these patients, and many times the insurance refuses to cover them. That all needs to be opened up for analysis and for people to understand. One reason that healthcare is so expensive is everything is paid for with somebody else's money. Nobody ultimately gets the opportunity to shop around and say, well, I can get a better bargain here than there. But why not? Why not make prices so transparent that people and insurances can shop around and find out where the best care can be had for the lowest amount of cost?
Love that idea too. Dr. Skop, I just love that doctors like you, who are obviously, you practice medicine very successfully, and you've been around practicing for quite a while in San Antonio, but you're also involved in the policy thinking, because so much of policy making by people in Washington who sit around in committees in Congress and the Senate and blather away about ideas how to solve things, they need to be listening to doctors like you, doctors in America, who want the best healthcare system, who want to try to improve it, figure out where the problems are. So I'm so grateful that, first of all, grateful for you, but also grateful that President Trump has been seeking the input of doctors in this country for 3.5 years to try to really dig and understand where the problems are, and then what policies make sense to solve them. That really sounds like a problem solver instead of a, wave a magic wand and fix everything kind of solution finder. So, Dr. Skop, thank you so much for taking time to join me today.
Thank you so much for the opportunity.
Great talking with you, friends. Oh, actually, wait, before you go away. What are you part of Trump? There's an organization you're part of related to President Trump, Physicians, what's it called?
Well, the big organization is called Medical Professionals for Trump. And I am on that advisory board. And I've also been involved in a smaller group. I'm not even sure if it has a name, but we've been having weekly phone conferences with the White House staff. And we've just been discussing how do we get the message out to the American people, and what do we do when Trump wins re-election to make healthcare better. And we've got a lot of ideas, and I'm very excited about the opportunity to implement many of these ideas over the next 4 years.
I love hearing that. Dr. Skop, again, thank you so very, very much for taking time to join me today.
Thank you.
Okay, folks, I think that's great to know. I'm going to, on our website, AmericaCanWeTalk.org, I have one other article I can post that's kind of a beginning of the summary of the ideas that are being discussed by people who are actually trying to solve the problems that arise in the healthcare system, as opposed to people who are telling America, don't worry, magic wand, single payer, everything will be free, and of course we'll be in a disastrous state as they are in countries that have socialized or single payer healthcare, socialized medicine, where you simply lose. You end up in socialized medicine in England, in Canada, more expensive, fewer choices, actually end up, and people don't like to hear it, but you end up rationing. You end up being told at your age and your health condition, we're not going to cover this, we're only going to cover that. You take away a fundamental idea of America, which is the freedom of the individual and the freedom of the doctor to move forward in providing the best health care. The primary relationship, and in fact, that was one of the big stresses out of the North Carolina conference, was the primary relationship is the doctor and the patient, not and the bureaucrat and the insurance company and the pharmaceutical company, everybody else weighing in and taking pieces away. I actually think we're going to end up, if we can stay on this path, I love that analogy she made about 5 yards at a time. Stay in the path 5 yards at a time, continuing to fix the issues as they arise, find solutions to the various challenges in the healthcare system. Sounds great to me.